Hello and welcome to another episode of Let's Talk Health. Today's session will be on osteoporosis, and to discuss this we have with us Dr. Aruna Sri, Senior Consultant Rheumatologist from Citizen Hospital, Sharing Hyderabad. Good evening, Doctor.
Good evening.
So before we start with the question, I request you to give our viewers a glimpse of your expertise.
Right. So my name is Dr. Aruna Malipete. I've done my post-graduation from United Kingdom, and then following that I have done my specialist training in rheumatology. And I specialize in treating rheumatological problems, of which one of the problems is the osteoporosis.
So let's start with the question, Doctor.
Yeah.
So my first question is, what is osteoporosis and is it same as osteopenia?
Okay. So basically osteoporosis is, there is a decrease in the bone strength and the bone mass, which will cause the bones to become weak. Osteopenia is sort of a precursor to osteoporosis. Osteopenia is where there is weakening of the bones, which does not lead to fractures, whereas osteoporosis, if the bones are weak enough, then they can cause fractures. If osteopenia is not addressed in time, then that will progress to cause osteoporosis.
So the next question is, Doctor, what is the symptom of osteoporosis?
Okay. So usually osteoporosis is asymptomatic, which means the patient does not have any symptoms. It is either usually detected after the patient has a routine health check where they check the bone mineral density, or when the patient has fractures and admitted in the hospital because of fractures. Once the patient has a fracture, then they can have pain and reduced mobility because of the fracture itself. Okay. Sometimes what happens is the patient, especially in the elderly patients, they can lose height. We see in the olden days, we used to see our great-grandmothers and grandmothers, they are bent over forwards. That is also one of the signs of osteoporosis. Patients would not notice that they have fracture in the vertebra, which causes the loss of height. So this is routinely, usually asymptomatic most of the times.
Okay. The next question is, Doctor,
Right.
which or what group of people are at risk for developing osteoporosis?
Okay. So osteoporosis mostly happens in women and usually after the menopause, which means after the periods stop, okay? But having said that, men also can develop osteoporosis, but they develop osteoporosis at a later stage, like when they're in 70s and so on. There are another group of patients who can develop osteoporosis, especially if they have other risk factors like sometimes some medication, if they have other health problems like inflammatory bowel disease, rheumatoid arthritis, or if they have malabsorption or if their weight is on the lower side. And also smoking and excess alcohol are also risk factors for developing osteoporosis.
The next question is, Doctor, does the diet and lifestyle of an individual have an impact on bone health?
Yeah, absolutely. Life and diet and lifestyle absolutely has impact on overall health and especially bone health as well. So sedentary lifestyle, reduced calcium and vitamin D intake, not having enough exercise, and smoking and excess alcohol all contribute to developing osteoporosis.
So my next question is, Doctor, what types of tests are performed to diagnose osteoporosis?
Okay. So basically, we do a scan to see the degree of osteoporosis. But at the same time, we need to find out if they have any other underlying risk factors which causes osteoporosis, especially in young patients or patients who had low trauma fractures. Okay. So blood tests include checking your calcium, vitamin D, kidney functions, liver function. And if you are suspecting if you have any thyroid or parathyroid problems, then we do blood tests to look at that as well. And if we suspect that the patient has other problems like malabsorption or inflammatory bowel disease, then we need to do tests for that as well to make sure that underlying condition is diagnosed and treated along with the osteoporosis.
So my next question is, Doctor, how is osteoporosis treated?
Okay. So basically, we need to decide whether the osteoporosis is primary osteoporosis, which happens with age, or is there any other underlying problem which is causing osteoporosis. So treatment depends on whether it is primary or is it secondary to some other problem. If it is secondary to an underlying other problem, then we need to address that as well. Suppose if the patient has smoker and excess alcohol intake, or if they have malabsorption, then we need to address all those things along with treating the osteoporosis. Just giving medication to treat the osteoporosis is not enough in secondary cases. So the treatment varies from tablets to injections, and the treatment depends on how severe the patient's osteoporosis is based on the scan, and also if they had any history of fractures, and if they have any sedentary lifestyle. So many other factors also will help us to decide the type of treatment the patient needs.
So the next question is, doctor, is osteoporosis hereditary?
So especially if we have a family history of osteoporosis, or if there is any history of fracture, maternal fracture, that is especially if our mother had a hip fracture, then we are at increased risk of developing osteoporosis, especially in women.
Oh. So the next question is, doctor, can a doctor monitor the patient's response to osteoporosis treatment?
Absolutely, we can monitor the response to the treatment itself, because it is quite important that we have to monitor, because some patients might respond to one sort of treatment and other patient might respond to another treatment. So based on what treatment we have given and the duration of the treatment, the doctor can definitely monitor whether you are responding to the treatment or not.
So the last question for today is, doctor, what happens if we don't treat osteoporosis?
Okay. So that is a very good question, because most of the time patient is asymptomatic. Then obviously they think that they don't need treatment for osteoporosis. It is quite important to recognize that in the last decade, from 2010 to 2020, there has been an increased risk of fracture from 158 million to 320 million worldwide. So that is a very worrying statistics. And also the prediction for the future is that from 1990 to 2050, there is increased 240% increased risk of hip fracture in women and 310% increased risk in hip fracture in men. So again, which means that we have 25 years of time from now onwards, which means we need to start addressing patients or people who are in their 30s now, so that this risk fracture can be reduced by 2050. Okay, and also it has been proven time and again that treatment reduces the risk of hip fracture by 40% and reduces the risk of vertebral fracture by up to 50%, 70%. So it is very important that we have to treat the patient. The treatment is not only with medication, the treatment also involves that we need to address the nutrition. We have to make sure that the patient gets enough calcium and vitamin D in their diet. And also they do exercise, especially weight-bearing exercise, minimum 20 to 30 minutes every day. And also we need to get some sunlight exposure, which gives us enough vitamin D production in the body. And also the other lifestyle habits like smoking and reducing the alcohol consumption is very important to treat the patient with osteoporosis. So as we all know that fractures and osteoporosis happen especially in the elderly population. So we need to make sure that the patients or elderly people have enough strength in their bones and the muscles to prevent falls. Falls prevention is a very important strategy to prevent fractures in patients with osteoporosis. The other important thing we need to consider is that when a patient develops a fragility fracture, they're at high risk of developing a subsequent fracture, especially in the first 2 years after the initial event. So this time we have to utilize to educate the patient, start the treatment on time, and then we need to encourage them to be mobile. Because we have a tendency that when we have a fracture, the patient becomes very fragile. They are very scared to go out, do exercise, walking and stuff like that. So we need to encourage them. We need to give them psychological support that they need to build the strength in the bones and the muscles as well. And then there is no need for them to stop exercising after the fracture. They need to be as mobile as possible, as soon as possible, to build the strength and reduce the risk of further fractures.
Thank you, doctor, for your valuable time and valuable inputs. So with this, we conclude our today's session on Let's Talk Health. We'll be back with another episode next week. Till then, take care, be safe, and thank you for being with us.
Thank you very much.